Hello, friends. Greetings from Eras Lucknow Medical College from the Department of Orthopedic Surgery. Today, I'm going to discuss immunotherapy in cancer. Guys, what exactly is this immunotherapy? It is a treatment that uses certain part of your immune system to fight against diseases such as cancer. It is also sometimes called as biological therapy or biotherapy, and it's a revolution against cancer. Let us go to the history of immunotherapy. William Coley was a New York based surgeon and he is considered as the father of immunotherapy. He first noted that getting some infection after surgery seems to help some of his cancer patients. In the late 19th century, he began treating cancer patients by infecting them with certain kind of bacteria, which came to be known as Coley's toxins. Although he had some success, his technique was overshadowed when other forms of cancer treatment, such as radiation therapy, came into use. Since then, doctors have learned a great deal about immune system. This had led to research into how it can be used to treat cancer using many different approaches. In the last few decades, immunotherapy has become an important part of treatment of several cancers. How it works: immunotherapy includes a wide variety of treatment that works in different ways. It acts by boosting the body's immune system in a very general way. It helps to train the immune system to attack cancer cells specifically and giving immune system components such as man-made immune system proteins. What are the type of immunotherapy? The main types of immunotherapy nowadays being used to treat cancer are monoclonal antibodies, cancer vaccines, non-specific immunotherapies, engineered antibodies, and CAR T cell therapy. So guys, let us see what exactly monoclonal antibodies are. Many copies of specific antibody can be made in lab. These are known as monoclonal antibodies. These antibodies can be useful in fighting diseases because they can be designed specifically to only target a certain antigen, such as one that is found only on cancer cells. Over the past 15 years, US FDA has approved many monoclonal antibodies to treat certain cancers, and monoclonal antibodies are of many types. They are naked monoclonal antibodies, conjugated monoclonal antibodies, and bispecific monoclonal antibodies. Naked monoclonal antibodies are antibodies that work by themselves, and conjugated are those joined to a chemotherapy drug, radioactive particle, or a toxin, and labeled as radiolabeled antibodies, chemolabeled antibodies, and immunotoxins, respectively. So, naked monoclonal antibodies can work in a different ways. Some may boost a person's immune response against cancer cells. Others work by blocking specific protein that help cancer cells to grow, and some may do both the things. For example, Herceptin, the trastuzumab, is an antibody against HER2 protein. It is used to treat breast and some stomach cancer that have large amount of this protein. And conjugated monoclonal antibodies are antibodies attached to a radioactive substance, drug, or toxin called conjugated monoclonal antibodies. These antibodies act like a homing device to take one of these substances directly to the cancer cells. This lessens the damage to normal cells in other part of the body and increases the killing power on cancer cells. Conjugated monoclonal antibodies are also sometimes referred to as tagged, labeled, or loaded antibodies. They can be divided into groups depending on what they are linked to. Monoclonal antibodies with radioactive particle attached are referred to as radiolabeled, and treatment with this type of antibody is known as radioimmunotherapy. Monoclonal antibodies with chemotherapy drug attached are referred to as chemolabeled, and monoclonal antibodies attached to cell toxin are called as immunotoxins. Radiolabeled antibodies have small radioactive particles attached to them, like ibritumumab and tocilizumab are examples of radiolabeled monoclonal antibodies. They deliver radioactivity directly to the cancerous B cell, can be used to treat some type of non-Hodgkin's lymphoma. These monoclonal antibodies have powerful chemotherapy drugs attached to them, and they are called chemolabeled antibodies. There are only two chemolabeled antibodies approved by FDA to treat cancer at this time. And chemolabeled antibodies used to treat cancer include brentuximab vedotin, an antibody against that targets the CD30 antigen found on lymphocytes, attached to a chemo drug called as MMAE. This drug is used to treat Hodgkin's lymphoma and anaplastic large B cell lymphoma. Edotrastuzumab emtansine, an antibody that targets HER2 protein attached to a chemo drug called DM1. It used to treat some breast cancer patients whose cancer have too much HER2 protein. Then immunotoxins. These monoclonal antibodies have cell poison toxin attached to them, which makes them similar in many ways to chemo-labeled monoclonal antibodies. At this time, no immunotoxins are approved to treat cancer, although many are being studied. Now, bispecific monoclonal antibodies, these drugs are made up of parts of two different monoclonal antibodies, meaning they can attach to two different proteins at the same time. An example is blinatumomab, which is used to treat some types of acute lymphocytic leukemia. One part of blinatumomab attaches to the CD19 protein, which is found on some leukemia and lymphoma cells. Another part attaches to CD3, a protein found on immune cells called as T cells. By binding to both of these proteins, the drug brings the cancer cells and immune cells together, which is thought to cause the immune system to attack the cancer cells. Now, the side effects of monoclonal antibodies. In general, most of them have the allergic reactions such as redness, hive, or itching, flu-like symptoms including chills, fatigue, fever, muscle ache and pains, nausea, diarrhea, and skin rashes. Now, the another modality, that is cancer vaccines. The goal is to treat cancer or to help prevent it from coming back after other treatments. Vaccines to help secondarily prevent viral induced cancer. Some strains of human papillomavirus have been linked to cervical, anal, throat, and some other cancer. Vaccines against HPV may help protect against some of these cancers. People who have chronic long term infection with the hepatitis B virus are at high risk for liver cancer. Getting the hepatitis B virus vaccines to help prevent this infection may therefore lower some people's risks of getting liver cancer. Vaccines to prevent treat cancer. Cancer treatment vaccines are different from vaccines that work against viruses. These vaccines try to get the immune system to mount an attack against cancer cells in the body. Instead of preventing diseases, they are meant to get the immune system to attack a disease that already exists in the body. Types of cancer treatment vaccine are tumor cell vaccines, antigen vaccine, dendritic cell vaccines, DNA vaccines, vector-based vaccines. Vectors are special viruses, bacteria, yeast cells, and other structure that can be used to get antigen or DNA into the body. Side effects of cancer vaccine include fever, chills, fatigue, back and joint pain, nausea, headache. A few men may have more severe symptoms including problem breathing and high blood pressure. Now the third, non-specific immunotherapy and adjuvants. Non-specific immunotherapy don't target cancer cells specifically and they include cytokines. Cytokines are chemicals made by some immune system cells. They are crucial in controlling the growth and activity of immune system cells and blood cells in the body. Cytokines are injected either under the skin, into a muscle, or into a vein. Interleukin are group of cytokines that act as chemical signals between white blood cells. Interleukin 2 help immune system cells to grow and divide more quickly. When a man-made version of interleukin 2 was approved by US FDA and in 1992 to treat advanced kidney cancer, it became the first true immunotherapy approved to be used alone in treating cancer. Now, the side effects of interleukin 2 are flu-like symptoms such as chills, fever, fatigue, and confusion. Most people gain weight, some have nausea, vomiting, or diarrhea. Many people develop low blood pressure, which can be treated with other medications. Rare but potential serious side effects include an abnormal heartbeat, chest pain, and other heart problems. Now, the interferons. These cytokines, first discovered in the late 1950s, help the body resist viral infection and cancer. The type of interferon are named after the first three letters of the Greek alphabet: interferon alpha, beta, and gamma. Humanized antibody therapy. Humanized antibodies are antibodies from non-human species whose protein sequence have been modified to increase their similarity to antibody variants produced naturally in humans. It can be necessary when the process of developing a specific antibody involves generation in a non-human immune system. Humanized monoclonal antibodies, 95% of the humans are made by grafting the hypervariable region or CDR of the murine antibody, which determines antibody specificity. Production of humanized antibody. Humanized antibodies are produced by grafting murine hypervariable amino acid domain into human antibodies. This results in molecule of approximately 95% of human origin. Now, uses of humanized antibodies. It includes reduction in the immunogenicity of an antibody. Therapeutic value of an antibody increases after humanization. Now, the another modality of treatment, that is drug that boosts the immune system. They include thalidomide, lenalidomide, Bacillus calmette-guerin, that is BCG, and imiquimod. Now, understanding CAR T cells. I've got a very good lecture of Professor G.K. Singh sir on this topic, and I'm playing that. Now, the another modality of treatment, engineered antibodies. Antibody engineering is used in the treatment of numerous diseases and many diagnostic tests. It exhibits several effector functions like antibody-dependent cellular cytotoxicity, phagocytosis, complement-dependent cytotoxicity, and half-life clearance. Each of these effector functions is mediated through interaction with a specific set of receptor and cell types. Antibody-dependent cellular cytotoxicity and phagocytosis through interaction of cell-bound monoclonal antibodies with Fc gamma receptor. Cell-dependent cytotoxicity, complement-dependent cytotoxicity through interaction of cell-bound monoclonal antibodies with a series of soluble blood proteins that constitute the complement system, that is C1q, C3, C4, etc. Immunotherapy is a revolution against cancer. The promise of immunotherapy is a cure for cancer without the serious side effects of chemotherapy, radiation therapy, and surgery. And that is all from my side. Thank you very much for watching.